When you think about some of the patients you've treated over the years, are there any in particular that stand out as particularly remarkable?
Yeah, there are. I can think of one patient who I had seen in my previous practice in Connecticut who came down to visit me, and he had a lump on his back, and the lump was, when I biopsied it, was loaded with white blood cells, and it looked like it was a lymphoma. And interestingly enough, he had been exposed in his work to a very potent solvent for many, many years, for over 20 years as a typewriter repairman. And it was a form of trichloroethylene. And I immediately suspected that there was a connection. And I did some things, gave him some different supplements that helped him remove that material from his body, as well as giving him some supplements which have been known to be effective in various kinds of cancer. The next time he came back, there was no lump to be found.
Wow. Now, have you noticed that you've treated people who have certain mental blocks or mental hang-ups, and do you ever talk to them about what those are, and then when they're resolved, their skin conditions go away?
There are definitely people who I've used techniques on to release various kinds of anxieties and stresses and conflicts. One of those techniques is neuromodulation technique, which involves tapping on acupuncture points along with a series of suggestions to release things. And I had a patient with herpes zoster, which was threatening to involve the eye and possibly even threatening to cause blindness because of its location on the nose. And that patient didn't want to take the medications that would have easily worked. So I used this technique, and the next phone call I got was, "It's all better." So that was a great relief for me as well as for her. There are a number of other techniques, and I had the privilege in the past 6 months of meeting John Sarno, who does a lot of work with psychosomatic issues where there are hidden underlying problems leading to the cause of disorders. And some of my work is leading people to that kind of release.